From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky, West Tennessee, even out as far as Jackson, Tennessee. Welcome to Pharmacist on Call. I am your host, Dr. Shawn Pruitt, owner of Pruitt's Discount Pharmacy. Here we are at show number 4. It's like the time is flying by already, headed to Independence Day Eve. Welcome to the show. I welcome your calls and your comments, certainly your questions. Rule number 1 here, there are no stupid questions, so feel free to ask whatever health related that you want to ask, and chances are the question is not stupid, because in many cases patients have told me that the caller's previous questions have benefited them. I also wanted to thank those of you who came by and participated in the commercial. So those of you who didn't get an opportunity, we'll be doing some commercials a little later on, but it will air during this show. I did want to start the show out by talking about the store. We're going to talk about some supplements, of course, and then the alkaline water. But for those of you, this you being your first opportunity to view this show kind of came from the open line series of Ask the Pharmacist, which was about maybe a year or so ago. So Channel 5 gave me the opportunity to have a patient-specific call-in question where you call in and I ask your questions and I answer them to the best of my ability. So here we are on show number 4. The pharmacy itself started August 4th, 2012, with a mission to help those who were uninsured. What I noticed in my research was that there were a number of people who were readmitted to the hospital, or sometimes did not make it to see the next day because medication was so unaffordable. So the mission of the pharmacy was to try to decrease the morbidity and the mortality of being uninsured by lowering the price of medication and making it more affordable. We've been doing that coming on 2 years now. The Middle Tennessee area has supported us very heavily, and so I thank those of you viewers who are also happen to be patients. So we're going pretty strong in that sense. We also have a second business that I will get into a little later, and it is the Kangen Alkaline Water Store. But as you know, this show is about you and your calls. So we're going to get to our caller on line 1. We've got Darren on line 1. Darren, welcome to Pharmacist on Call.
How you doing?
I'm pretty good. How are you?
I'm pretty good. The reason I'm calling is my doctor has me on Neurontin or gabapentin because I had nerve damage in one of my feet.
Yes, sir.
And what do you know about this drug? And do you think it's a drug I'll probably have to be on for the rest of my life?
You said you had nerve damage where, sir?
In my right foot.
Probably. Probably. This medication actually started out as an anti-epileptic drug or a seizure drug. But what they noticed is that this drug slows down the nerve transmission signal of pain. And so that's why we found it useful in patients with neuropathy, patients like yourself.
Yes, yes.
Will you be on it long term? Most likely, depending on the severity of the damage.
Yeah, I've been on it for about 2 years now.
What dose are you on?
I think it's they're capsules. I think they're 300 milligrams.
Yeah.
That sound familiar?
Yeah, and it's probably yellow or yellow and white capsules. 300 milligrams is a fairly safe starting dose once or twice a day. I've seen it go up to upwards of 800 milligrams 2 to 3 times a day. So you can go up pretty high on that medication. Is that dose working for you?
Yes, it keeps the nerve damage. The pain seems to, it's not very, very severe. It will kind of tinge here and there from time to time, but it's been pretty effective for me. When I don't take it, which I do take it every day, but it really does lessen the severity. It really does. I don't really think I could be without it, actually, because I'm too afraid to even miss a dosage, to tell you the truth, because it's been working pretty well for me. But I just wondered how long I probably will have to be on such a drug as this.
If that nerve damage is permanent, then you're most likely going to be on it for the long term. Is that the only pain medication that you're on?
I take over-the-counter ibuprofen.
Okay.
Yes.
then I'd say that's pretty good. Some people are on heavier pain regimens than that. So if you're just on gabapentin only and it is meeting your needs at 300 capsules, 300 milligrams a day, I'd say that's very good.
Yeah. Well, that's really all I needed to know.
Okay.
And thank you for your time.
Okay, thank you.
You have a good day.
All right, you too.
Bye.
All right, it looks like we have Philip on line 2. Philip, welcome to Pharmacist on Call. How may we help you?
Good evening.
Good evening.
I have a prescription for Chantix.
Yes, sir.
I am insured through my employer. However, our group, which makes no sense to me how this can happen, but our group does not cover anything for smoking. So I took my prescription to the pharmacist, and the cheapest I've found to this point is $200 for a 30-day supply, and I'm supposed to take it for 3 months.
This is the starting pack?
Yes.
Okay, I think I can beat that. Well, let me just put you inside the mind of the insurance company. This medication to them is what is considered a lifestyle drug. So drugs like Chantix, drugs like Viagra, and even some dermatological medications are considered lifestyle drugs and something not necessarily necessary. Now, as a pharmacist, I think Chantix would be a good thing because you increase your lifespan by getting you to stop smoking. So that's why they don't cover it, because it's considered a lifestyle drug. But give me a call Sunday at the store. I can beat that price.
Excellent.
Yes, sir.
Excellent.
And the number, the address, and everything will be on the screen at the end of the show.
Okay. Thank you.
All right. Yes, sir. You're welcome. All right. So the second business I wanted to jump into that, we have alkaline water, which is water that goes through about 4 processes. We have a $4,000 machine, and it takes it through about 4 different processes. The first process is it filters out the chlorine. The second is it filters out the fluoride. So when you taste this water, there will be no taste, there will be no smell, as you will have with the city water. It goes through about 4 or 5 platinum plates, which electrifies the water, fills it with antioxidants, which you know are your cancer fighters. And then the fourth process is alkalinization. The pH range is anywhere from 2.5 to upwards of 11. We pretty much dispense mostly 9.5 in terms of alkaline drinking water. It's probably on par with my prescription pharmacy business, so it's very popular. What are the benefits of drinking this water? Certainly, to be hydrated, because your body is 70% water, and you need the best water put in you. Most of the patients and most of the customers who come in, the reason they drink it, acid reflux is at the top of the ladder, gout is going to be at the top of the ladder, and arthritis. So you say, well, what is the rationale for that? How can water, help with acid reflux? How can water help with gout? This water is at such a pH, at such an alkaline pH, that it neutralizes the acid that's bubbling in your stomach, neutralizes the uric acid that you find present in your joints, causing gout. And so once you drink this water, the pH begins to rise. So I've had a number of people, well, I'll say 2 patients, come off of their omeprazole, which is generic for Prilosec, in probably a couple of months of drinking the water steadily, and probably some diet modifications as well. And then certainly the number one reason that you're going to get acid reflux, which is eating and laying right down. Okay, so I encourage those of you who do have acid reflux, big no-no, eating a heavy meal, laying down. But let me explain to you why. Because when you eat and the acidity is kicking up in your stomach, and when you begin to lay down, the acid begins to rise, and that's why it is gastroesophageal reflux disease. So make sure you're sitting up at least 1 to 2 hours to give your body time to digest and give the time for the acid to quell down. It looks like we are up on a commercial break. You sit right there. Feel free to give us a call. Your calls about any type of health questions. We'll be back shortly.